What is a normal period? A normal period is something which lasts between 22 to 35 days. So any period which is coming beyond 35 days is not normal. Also, there is nothing called as a perfect 28-day cycle. For someone, maybe 25 days is normal. For someone, 35 days could be normal. But in case you have a variation of more than 8 days in your periods, and in case this variation is occurring more than 2 or 3 times in a year, now this means that you need to see a doctor.
So why can an irregular period happen? Now physiologically you need to know, what do I mean by physiologically? Then naturally. Just when you start your periods, which is when you attain menarche, your pubertal years, your adolescent years, it's normal to have irregular periods because it takes about 4-5 years for your cycles to become regular after you start your periods. And then perimenopausal, that means before you are attaining menopause. A couple of years before that, your periods are going to get irregular. You'll get them once in 3 months, then 6 months, and 1 year, and it'll eventually stop. But in between that, which we call as a reproductive life, between menarche to menopause, you're not supposed to have irregular periods. And if you're having these extended periods of amenorrhea where 2 months, 3 months, patients come to me that I haven't bled in a year. Now, why can that happen?
There could be some natural reasons like the way I explained, the diet and physical activity, but sometimes there could be medical reasons. Like, for example, there could be a thyroid problem, there could be PCOD problem, and there's a hormone called prolactin, which is also released from our brain. So in case that becomes high, now that also can disturb the period. Also, women who are lactating, they will naturally have irregular periods. A woman who is heading towards her menopause, who is in her 40s, will also have irregular periods.
So if you are somebody who hasn't bled for many months, or somebody who is bleeding frequently every 10 days, 15 days, either which way, or somebody who's having postcoital bleeding, please go seek a gynecologist. We are going to run you through a series of tests which will rule out whether it's endocrinal, or an ultrasound will help us rule out whether it's a local cause. A general pelvic examination is going to help us see visually or feel, during a pervaginal examination if there's a mass. And then eventually we'll come to a diagnosis, give you the right treatment. And you should know that a reproductive woman should bleed at least 4 times in a year.
Remember, the irregular period could be a sign of a bigger problem. So just don't think, okay, my friend is also having irregular periods, so it's okay for me to have irregular periods. Don't ignore it. Anemia, yes, of course, can cause a lot of other problems, but per se, this is not a problem. This is not the reason for the irregular periods. It can decrease the flow of the periods. It can cause hair fall, lethargy, tiredness. But irregular periods do not happen because of the iron deficiency. So the reasons are purely hormonal.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.